an alarm over a high number of COVID-19 cases being recorded in the country, with fears that it may rise to unmanageable figures. This was after 447 new cases were recorded over the last 24 hours. Health Cabinet Secretary Mutahi Kagwe is now warning Kenyans to be extra vigilant and not lower their guards. Our coast-based reporter Tobias Chanje begins our bulletin tonight with that story.
A visit to the coastal town of Mombasa was the second point of call as he tours various counties to assess their preparedness to combat COVID-19. The county has the second highest number of COVID-19 cases in the country after Nairobi. His visit came with the bad news of the country recording the highest number of COVID cases per day.
Today, for example, out of the figure that I have said, 282 positive cases are men, while 167 are women. While by age, we have a one-year-old infant who was tested positive and an 88-year-old. I am sad also to say that over those 24 hours, we have lost 4 more patients to the disease. Our total fatality is now 173, and my deepest condolences to all those who have lost their loved ones.
And is warning of a serious flare-up in the coming days if Kenyans are not careful.
What we are seeing today, in terms of the numbers, is exactly what we had expected to see. In fact, we said so some time back. We said so. We said that we expect the figures to go up, and that's what we are preparing for.
But that notwithstanding, it's not a question of just machines. You also require human capital to be able to operate these machines. And also in terms of presentation of our cases, 90% of our cases are asymptomatic. And if you look at even those who are critical, as of today we have 40 people in ICU. 20 of them are on ventilatory support and 20 on supplemental oxygen. So we are also putting a lot of emphasis on oxygen piping and cylinder oxygen for all facilities.
The 447 new cases was recorded from a testing sample of 3,803 taken over the last 24 hours. The total number of positive cases now stands at 8,974. So far, 200,311 people have been tested.
And the reason why I am here today and the governor and his government are working so hard to expand the capacity that we have is exactly because of that.
At the same time, the CS commended some of the counties that had surpassed the 300-bed capacity, including Mombasa, although acknowledging that more still needs to be done. This in reference to an influx of people that will be thronging the coastal cities as guests and tourists.
We do about between 400 and 500 tests every day, and we've been consistent since we started mass testing in Mombasa. So that is the case. There are centers in which the people of Mombasa who feel that they exhibit some symptoms can go to for testing. So that is it's continuous, and it will go on until when we feel that this epidemic has been defeated. Yes.
What happens by a runaway situation has happened in Italy, has happened in New York, you know, and if it can happen in New York, you know, it can happen here.
The CS is expected to tour Kilifi County tomorrow and Kwale on Saturday for a similar mission. Tobias Chanje, KTN News, Mombasa County.
Well,